Hello, my name is Gavin, and today I'm going to be talking about an endocrine system disorder known as diabetes, more specifically type 1 diabetes. I will be going over what it is, what's causing it, and what are we currently doing to treat it. Enjoy. So before we can start discussing type 1 diabetes and what it is, we should first discuss some key concepts behind type 1 diabetes. And one of these concepts is insulin. Insulin is a protein hormone that is produced in the pancreas. So someone with type 1 diabetes, it means that their pancreas does not produce insulin. So here is an example of someone whose pancreas does produce insulin. Here we have the capillaries. This will be somewhere in the muscles. This will be flowing past cells. Now, a cell would stick out something like this, and on the outside of these cells, you have these tiny little, almost like capsules that capture insulin. These are known as insulin receptors. Now, what these receptors do is that while the blood is flowing, they are specifically designed for the intake of glucose, and I'll explain this in a second. In a normal person's bloodstream, well, not normal, healthy person's bloodstream, we have glucose, red blood cells, hemoglobin, all types of hormones flowing. So the green is going to represent glucose in this person's blood. Now, also another hormone found in a healthy person's blood is insulin. So now, while insulin is not as readily available as red blood cells, it is found in someone whose pancreas does produce insulin. So we can see over here that right here, these are the insulin receptors. And the job of these insulin receptors is to grab onto one of these. So this will attach to that. It'll look something like this. And now when this happens, it allows a safe passage for glucose to then enter the cell. So these are glucose. Once the insulin receptors have attached, only then can glucose enter the cell. Now, cells need glucose for many different reasons. The main one is in order to produce energy for us to use. So if you think about it, it makes sense. Without insulin, you have extremely high blood glucose levels. However, you may not have much energy. You'll feel drowsy and nauseous and dizzy when you stand up too quickly. These are usually a sign of not enough insulin. So insulin is produced in the pancreas, as I mentioned before, and it's not something that someone can catch from someone else. It's a genetic disorder. You're born with it. It's unlike type 2 diabetes, which you can develop over your lifetime. So this is what a normal person's blood will look like. Sorry, not normal, healthy. So this will be a healthy person. So there, A plus for health. Now I'm going to show you what in a person who's lacking insulin, person with type 1 diabetes, this is what their blood would look like. So here we have once again the capillaries with the red blood cells on the inside, and the direction of flow is going to be up. So here's where the blood is flowing, and just like a healthy person, even people with type 1 diabetes have cells. Everyone has cells. And still on the outside of these cells, there's still insulin receptors. So we can see these little insulin receptors on the outside of the cell still. And there's still glucose in the blood. So we still have little glucose monomers flowing around. And however, the glucose cannot enter the cell. And the reason for this being is there's no way for the glucose to enter the cell without insulin being attached. So there is absolutely no insulin inside this person's blood. Over here, in the healthy person's side, we can see that this person actually does have insulin. There. And when the insulin's attaches, then the glucose can then enter the cell. However, this glucose is just going to flow straight past the cell as there is no insulin here or here. This is basically type 1 diabetes in a nutshell. Of course, it's far more complex than this, but this is basic. So this is type 1 diabetes, and this is a healthy person. Of course, in a healthy person's blood, there is a lot more flowing around. It's not just insulin and glucose and red blood cells. But this is generally what it would look like. So now that we've gone over what insulin is and how it helps cells absorb glucose, I think next we should go over what type 1 diabetes is and what really causes it. What causes the pancreas to stop producing insulin? And this is what we'll be discussing next. Okay, so now that we've discussed what type 1 diabetes is and how insulin works, I think we should discuss what causes type 1 diabetes. So type 1 diabetes you can get type 1 diabetes anytime through your life, but it's usually commonly diagnosed within children and adolescents than it is in adults. Now, the reason for this is that I'll explain it later. So here we have a picture of the pancreas. That's down here. Here we have the liver is over here. This is the gallbladder, the stomach, the small intestines, and then right here, this is what we need to focus on right now, is the pancreas. Why do we need to focus on this? Because the pancreas, what it does is it produces insulin cells, and it does this as soon as we're born. That's why I say that as soon as it's usually diagnosed in adolescents or younger kids. And the reason for this is, as soon as we're born, we start producing insulin through cells in the pancreas. And what happens is we are born with the ability to produce insulin. However, we have an immune system, of course, and our immune system sees these insulin-producing cells as a threat. So imagine these are some insulin-producing cells in the pancreas right here. This is a pancreas, and what the job of this pancreas is to try and produce insulin and send the insulin out into the bloodstream. This is a capillary. So it'll try to produce insulin and send it out into the bloodstream. It's produced by these cells here. These are insulin-producing cells. And it'll try, from the moment we're born, we're producing insulin, because insulin is needed, as I mentioned before, to absorb glucose into cells. So our immune system, which I'm going to represent over here, this is not what our immune system looks like. When we are born, it sees these cells, these insulin-producing cells, as a threat. And the reason for this is not yet known, but they believe it's got something to do with the genetic codes, as type 1 diabetes is usually genetically inherited. So that means you get it from your parents, your grandparents, somewhere through your genetic line. So it's more than likely a problem with the genetic code. And what happens is, as soon as our immune system starts functioning correctly, which is usually as soon as we're born, that's when our immune system is working its hardest to keep us safe from diseases, it for some reason sees these insulin-producing cells as a threat, because of course the immune system doesn't know that. They're just trying to help. The immune system sees this as a threat to the body and does whatever it can to make sure that the body stays safe. So what the immune system does is it sends out cells to try and destroy not only the insulin in the blood, but as well as the insulin-producing cells. So it'll destroy the insulin-producing cells, and then from that moment on, once our insulin has been used up in the blood, there is no longer any insulin entering the bloodstream, which is a major problem, as we know, because cells, they need their glucose intake, but without insulin, there's no glucose intake. So type 1 diabetes is usually diagnosed in children, and what the cause of it is that the immune system destroys the insulin producing cells in the pancreas. And that pretty much sums up the cause of type 1 diabetes, as far as we know so far. So we just went over the cause of type 1 diabetes. We learned that it's our own immune system that destroys insulin producing cells in our pancreas. So now that we've gone over the problem and the cause, the only thing left to discuss is the solution. And in the solution I will be discussing what is currently being done to treat type 1 diabetes as of May 13th, 2014. So we've just gone over the cause for type 1 diabetes. Now the only thing left, as I mentioned before, is the solution. So this is what's being done to treat type 1 diabetes. As of May 13, 2014, this is the #1 way to treat type 1 diabetes. So I'm going back to the first diagram that I drew of a type 1 diabetic patient. And so as we know, this type 1 diabetic patient has normal cells, he has insulin receptors, and he has red blood cells flowing through. So he's got everything flowing. This is the direction of flow right here. And the only thing that he's lacking currently without the treatment is insulin. So how do we get the pancreas to start producing insulin again? It's simple. We do not. The pancreas does not produce insulin anymore. However, we can inject insulin into the bloodstream. This allows for a quick access for the cells to insulin. Now, of course, there are some flaws that I'll discuss later, but I'm going to show how it works quickly. The patient will use a syringe to an injection to inject themselves with insulin. Usually they know how to do this by checking blood glucose levels, insulin levels, stuff like that. But today's technology allows for portable access to these equipments. So once they inject insulin into the bloodstream, it's flowing around. It takes a while. It usually takes a full circulation, 1 or 2 circulations, so between 20 and 40 seconds for it really to kick in. And when this insulin is in the bloodstream, oh, I forgot to draw glucose. So when the insulin is in the bloodstream, it then can finally bind to these insulin receptors. And you know that's good news for the diabetic patient, because that also means that the glucose can then enter the cell, which is great because now the cells can use glucose to produce energy. So some of the flaws with this is that it is a quick and temporary source of insulin, which does cause many irregularities within the bloodstream. And another main cause of this is called insulin shock. So insulin shock is when insulin suddenly enters the bloodstream and all of a sudden there's a high glucose level, and then all of a sudden these cells are being absolutely bombarded with glucose. Then all this glucose then enters the cells as soon as possible due to all the insulin, and then we find that there's actually hypoglycemia. What hypoglycemia means is that there is not a high level of glucose in the bloodstream. So all the glucose will be inside the cells, or well, most of it anyway, not all of it, and there'll only be a little bit of glucose left. This leads to hypoglycemia. This could be a major problem, especially when it comes to someone who needs long-term energy. This is why you'll find after someone takes an insulin shot, they will soon after start eating a candy bar or something that'll boost their glucose levels again. So insulin shock is one of the major causes for this, and I actually have a friend who has type 1 diabetes, and I've seen this. Straight after he takes his insulin, he checks his blood glucose levels, and if he is going through an insulin shock, he then eats like a candy bar to boost his glucose levels. So that pretty much sums up our solution. So what happens is diabetic patients of type 1 diabetes will inject insulin into the bloodstream. well, so do type 2, but they will inject insulin into the bloodstream, and then it then uses this insulin as it would be used if the pancreas produced the insulin. Finally, we went over the temporary solution to type 1 diabetes. Now that the video has come to an end, let's review a little bit. We went over the problem, which is the pancreas not producing insulin. We also went over the cause, which was the immune system destroying insulin-producing cells within the pancreas. Then we went over the solution. And while the solution is not perfect, injecting insulin directly into the bloodstream does provide temporary insulin for glucose absorption. Thank you for watching my video, and I hope you found it very informative. Goodbye.